Hello, everyone. My name is Casey Bader. I'm a vice president here at Handel Information Technologies, and I'd like to thank you for joining me today for our webinar, Informing Better Outcomes in Indian Child Welfare with RiteTrack. RiteTrack, for those of you who may not be aware, but I'm never focused on my PowerPoint when I want to be, is a software system that is designed for tribal services. We offer several standard modules, and it's a customizable platform as well. Today, of course, we're going to be focusing on the Indian child welfare module, but so that you're aware, we also have modules for domestic violence, tribal court, probation, enrollment, financial assistance, treatment services, TANF, and employment and training. So those are kind of the scope of the programs that we work with most commonly and that we have standard solutions for. Now, while often RiteTrack is implemented for a single department, it becomes exceptionally powerful when it integrates the needs of multiple departments and programs. What that allows you to do is have a central database that has all of the data on your members and clients, and every different department has their own access to that and their own functionality, as well as security, ensuring that information that should be confidential between departments, it remains confidential. Some of the features of RiteTrack, I mentioned this when I was listing the modules, but RiteTrack's a customizable platform. So if there's something that you don't see today, that's not uncommon. Our goal with the standard modules is, can we provide a system that is 75, 80%, say, of what most Indian child welfare programs will need, especially if they do BIA reporting? And knowing that that last 20%, we're probably going to customize. We're not going to have the documents and letters that you generate and provide to your families or clients or other organizations. And that's part of the implementation process, is to customize those things into the system so it's truly reflective of your program. RiteTrack's web-based. That doesn't mean it lives in the cloud. It can. We do offer cloud hosting, or the system can be hosted on premises as well. An important question, if there's any IT people in the audience today, it is mobile and can be used on tablets or mobile phones. So in the field, so long as that is permitted by your IT department. I mentioned it particularly important for integrated systems, the security model that's in place that can be role and criteria based. So if I'm an equal caseworker, I may have a certain access to cases and person records. But if it is criteria based, then I'd only have access to a case if I was assigned to it. So there's a lot of different things. You can be very granular in how you define your security model within the system. Every user is able to set up their own dashboards that will present to them when they log into the system for the first time the information that's most important for them to see. And you'll see an example of that as soon as I log in. And then I also mentioned, part of the customization is creating those documents that you may have. It may be creating whole new screens if there's things that you track that we don't have standard. But the form builder very easily allows us to create those documents that you need to generate out of the system. Some of the functionality that's specific to the Indian Child Welfare module includes tribal affiliations, of course, very important for tracking, and you can have multiple within RiteTrack. Active efforts that you've made or have been made on a case before you received it. Referrals, both external, so those referrals you make to outside services for your families, as well as internal, those referrals that you receive and then follow up on. And then within those referrals, we document incidents that were reported on, and then your findings as well. Out of home placements along with foster homes. And then I mentioned this earlier, but RiteTrack is built on best practices that we've found over 20 years working with tribes and Indian child welfare programs. But with our most recent platform release, we also incorporated the best practices and needs and reporting requirements of the BIA quarterly and annual report. So if that's a report you generate with RiteTrack, as long as it's not the narrative, the system will provide you with all the statistics for that report. And we'll look at that. A little bit on Handel. We've been doing this for 20 years, over 20 years now with tribes. We're currently serving 65 tribes across the United States and in Alaska. And RiteTrack's not just a system, but it's a partnership with Handel IT to ensure that you have a successful system. So some of the services that we provide include configuring the standard functionality to match your needs, for instance, the active efforts that you track, or the problems and goals and goal actions that are part of your case plans. Those are that's standard functionality that's configured to match your needs. Then there's the available customization, which I've talked about a few times. If you're using an existing system that's become outdated, and we run into those quite often, then we offer data conversion. And if it's a system that is we've run into before, one of the usual suspects of those other ones that we run into in Indian country, we've probably upgraded from those before and have a data conversion routine ready for it. And finally, we provide training because everyone should know exactly how to use the system. We know how important that is, as well as the support that we provide after the system goes live, and we get great feedback from our customers about the support that they receive. I will put this slide up at the end of the webinar. If you're interested in more information, feel free to reach out to me directly or info@handelit.com. Give our toll-free line a call, and I encourage you to visit our website for a list of upcoming activities that we have, like webinars, conferences, and presentations. I think our next webinar is going to be on the employment and training module, and the next conference is the National American Indian Court Judges Association conference. If any of you will be there, I'd love to see you there. Okay, enough of an introduction. Let's go ahead and take a look at what RiteTrack is and how it works. A dashboard that can be defined by each user. In this case, what I have, it looks like my screen share may not be working. If anybody can put anything in the chat, and somebody isn't hearing anything, but I haven't seen that from anyone else. It looks like my share stopped. Let me share again. Sorry for the technical issue here. And if anybody could just put in the chat whether or not they're able to see, it does look like we're seeing. Okay, great. So here we are on my calendar, and it's displaying to me the things that I have upcoming. You can see here I have several hearings documented. The calendar is interactive, and so if I want to open one of these hearings, rather than going to it through navigation or finding it through the search functionality, I can simply click on the hearing in the calendar or right click on it and actually open multiple RiteTrack records in different tabs, which is a new feature it's been very popular with our users because it eliminates some of the necessary navigation and gives them more immediate access to opening more records. And you'll see, like the entries in the calendar, there are things or text in RiteTrack that's hyperlinked that will also take you directly to the corresponding records. I can access my dashboard anytime by clicking on the RiteTrack logo here on the upper left, just a little bit of navigation on how the system works. We have search functionality in which I can search across all data in the system or just a specific category. And then our navigation pane. And we have three sections here, the info, actions, and favorites that we're going to be going through today. The first is the info, and that's going to display whatever record I'm on currently. When I log in, that's the current user. I can go to my information, and there's summary information about myself as well as my employment. Reports that are available for the user, like their caseload. Their case activity, that is their case plans, the case records that they're involved in, as well as their hearings. And then standard parts of both user and family or client or advocate or attorney records. They can all have different person records in RiteTrack. Contact information that includes addresses, emails, and phone numbers. And we'll always see that on person records of any type. Also on person and case records and other places, we'll find documents and notes. And documents is where you're able to import anything you can store electronically into a RiteTrack record. So that might be something that you've received in hard copy or a photograph or digital image, like my smiling face here. And then place for notes. Now, while every category of information in RiteTrack has a narrative associated with it, there's also places for just catch-all notes. And in this case, like an employment interview for when I was applying for this position. And then we have the user-defined dashboard and the tiles that they have selected to see when they log into the system. So just wanted to go through what a user record looks like, and that's accessible both by the user as well as supervisors and other users. Our next section is the action section, and from here we can create new records, new organization, person, hearing, walk-in, case, record, or foster home, and I have access to our global or statistical reports. Our philosophy at Handel with our reporting is if the data's in the system, there should be a report to pull it out either in summary or statistical fashion. So to that end, every RiteTrack module comes with a battery of standard reports. And just as some examples of what's included here, we can look at our case records by current status. And I should mention that almost all RiteTrack reports are multiple parameter. So this is showing me all case records of all status types. If I only wanted to see those that were open then and pending, then I can select those and rerun the report, and I'll only get those open and pending cases. Additionally, in addition to the information, then RiteTrack reports generally have a breakout available. So you can see here the count of the case records that are open and pending, but then I can also see the breakout here of all of these, and these are hyperlinked. So if I wanted to go and review the Andrew Dalton Child Protective Services case, I can open that up from the report and go directly here, as we could from the calendar. Case records by users just for case loads. Referral statistics for referrals that you've made to outside services, and the ability to filter down into what referral types these were and which users made these referrals. A couple more active person placements would be an important one. This is just summary of all of the current placements, as well as hyperlinks to the children or the current placement, which we'll get to after we cover a few more reports. As far as statistical reports go, things like the placement statistics will provide statistics like gender, race, age, breakdown of children that were in care over a type or over a date range, and I can select and filter down into different types of care that I want to see. Assessment, hearing, drug test statistics, mailing lists, as well as the quarterly and annual report. This is a very involved report. There's a lot to it. If you're familiar with the BIA report, then you're going to know that. But here I can choose several different parameters to be able to look at. I only want to see a report on certain placement types or cases in current status or the referral types, as well as choosing whether or not to view the breakout of this data. And I'm not going to do that right now. Oh, actually, we are looking at the breakout. We're going to hide the breakout. It is there now, but it creates a 4-page report, and I don't need to see the breakout, so I'm going to refresh and hide that. And what we're going to get now is information about the number of referrals you've received, the number acted upon, state courts hearings, case plans, those cases, the number that have been transferred to tribal court, the type of placements that you've seen over a time, incidents as well as findings, and the type of abuse that was involved. Anything that's not narrative from the BIA report will be generated by a RiteTrack. And to see where that information comes from, let's go to our favorites view. This is where most users will spend the majority of their time. And this is where I have favorited the case records that I'm currently working with, foster homes, organizations, and people. Let's start with people, because RiteTrack's a person-centric system. Everything revolves around the person record. They may be involved with multiple case plans or multiple cases and multiple hearings. That all centers around a single person record. And it starts with person information, the ability to associate a photograph that would come from the documents that, of course, is ever present, as I mentioned, on the user record, as well as multiple demographics from uh, demographics to appearance, and then, of course, giving us and you the ability to report on the demographics of the families and children that you're seeing in your programs. In addition to statistical or global reports, we have reports that are available on person records and case records. So this individual might have their own calendar, and you can see here they've got a busy week next week with an immunization, family meeting, and home visit. These are just obviously examples. This may not be realistic, but this calendar is interactive as well. And so I can open up multiple records from here. A summary of all the placements that this individual has been a part of, as well as some other reports. Background information, and I'll go through some of these quickly because they're fairly straightforward, especially like an alias, aka maybe a maiden name, tribal name, current and or past education history. And as I'm going through here, I'm going to be clicking a couple buttons that you're going to see. They're common throughout any screen in RiteTrack. And that's the edit button that'll allow me to open up this record to edit. And the information button or details button that will open up the details, which may, and we'll see as I go through, include other categories of information for that particular record. Insurance, legal numbers, and then, as I mentioned previously, in addition to families, children, you may have advocates, guardian items, individuals who are licensed to provide foster care, attorneys, any of those people can have their own records in RiteTrack, and for those, we're going to be importantly tracking licenses, and then the ability to report on our active, for instance, foster care licenses or guardian ad litems, as well as those that are expiring, so that you can follow up on those and ensure that you don't have them expire. Person markings, which may be a permanent marking, tattoo, piercing, otherwise, or evidence of abuse or neglect. Important for the BIA report is relationships. So RiteTrack tracks the reciprocal relationships between people in the system, as well as whether or not they're a guardian, emergency contact, resides with this individual, or is flagged for no contact, and then date ranges for this particular relationship, and then tribal affiliation or affiliations. And of course, this is going to be very important in documenting if a child may be eligible for enrollment, and then what is their affiliation if they are enrolled, what's their number, and the date range of that status of their eligibility for enrollment to a particular tribe. Our goal with the background information is to give you a kind of 360 comprehensive review of this individual, the information about them, and where they're at currently in their life. We also have medical information to that end, to include medical events, which we saw the immunization on the calendar for Joe. And so that's going to show up on his calendar, and we document that occurred. Current or past medications that this person has been prescribed, and any history of mental health issues. Of course, the ever-present documents and notes. And then into the more day-to-day, once a record is entered, we have this background information, perhaps medical information. Of course, this may be updated and changed, but once it's entered, then generally, that's not touched very often. Where the day-to-day efficiencies with RiteTrack come in is in tracking case activity. And cases have their separate record, but we'll look at case activity record under the person as well, as there's some categories that aren't under a case, and then there's some that are duplicated, and we'll see that. We can track alerts about our individuals, their appointments, which again show up on the calendar, assessments that have been completed. Now, standard functionality is just for tracking that an assessment's been done. If I open up the details of an assessment, then I'll get summary information about the assessment, its score, if it had a score, range, as well as whether we have a hard copy on file and if it's related to a particular case record. And then if this was done in hard copy, then we can import the document that we scanned after that was completed. Case plans allow you to document, we call it a case plan, treatment plan, service plan. I've heard of all of those. The important part of the case plan is we're looking to affect positive change for this individual, and we're defining how and or why and how we're doing that. So opening up a case plan record gives me access to summary information about the case plan, reports, like a summary of everything that is included in this case plan, links to documents within that report, notes, of course, participants in the plan and their role, and the status history of the plan. And the most important part is defining goals. So in this case, for this Fenster Family Reunification Plan, we have the goals for substance abuse treatment, as well as housing, complete substance abuse treatment, and obtain stable housing. Information about the priority, creation, due date, and current status of this goal. And then the action items, which I can access by clicking here, and those are the activities that the team members of this case plan are going to take in order to fully achieve these goals and success for those people that you are working with. And you can see here, attend counseling, provide you 30-day clean UA are the next action items that Joe has for the goal of completing his substance abuse treatment. Back to our person record and delving further into the case activity, case records. This person is involved in, you can see he has his own, but he's also involved in some way in test pens record. If the individual child has been in outside custody, then that's documented as well. Was this a state or tribal custody? Who had custody of the child? And then when did they have custody? We can track drug tests, and in addition to saying this drug test occurred, RiteTrack also will generate record for each of the drugs tested for and their individual outcomes. Hearings that may be a part of cases as well. If I look at a hearing record, we're going to see summary information about the hearing, narrative about it, of course. If it was related to a prior hearing, for instance, a failure to appear, we can document that here, and the related case record, and individuals who were present and how they attended the hearing. putting that, of course, hearing in their record and on their calendar. Placements are documented in this fashion. We document, all right, who is the person being placed? Of course, it's Joe. Is he being placed with a person, an organization, a person licensed to provide foster care, an organization, so institutional care, or with a foster home? And then the system will filter down to foster homes, organizations, or licensed individuals. What type of placement is this? Again, these best practices, but also from the BIA report. And what was the funding source for this placement? And what was the date range that they were in this care? And then referrals. And their referrals mean different things depending on where they are. I'm under a person record, so these are referrals that I've made to outside for this family for assistance from some outside program. But if we get into our case record, which we'll go to next, back to my favorites, referrals refer to the referrals you've received internally. So a case may have multiple referrals, and under each referral, you're able to document course documents and notes, status that this status is that this referral has gone through, some available reports, like examples of re- letters rather that we can generate out of RiteTrack. This is notifying somebody about an investigation and its outcome. Another example of sent to a referring agency. And then incidents, there may be more than one. And for each incident, we drill down into narrative and summary about the incident, but then findings, individual findings. So this was investigated or referred to us for child neglect, alcohol, physical abuse, and drugs or inhalants. And what did we find? That 3 of those were substantiated and 1 unsubstantiated. Again, going back, this is going to go back to the BIA report. Outside of the referrals, there's a lot of other information included in a case, reports available on the case, active efforts, which you're able to define, case plans, and we've seen these before. These are just particular case plans that are part of this case. A case plan doesn't have to be a part of a case, so it may just live under a person record. Contacts, and a couple of things to point out here. Number one, before I open the detail, RiteTrack will take a look at the start and end date for the contact and calculate the time spent if that's important if you're receiving reimbursement through a grant. And also, RiteTrack gives you the ability to, for things like contacts or any narrative really, if it has a type, then there can be default text that's inserted into the note to prompt users for what should be entered if this is, for instance, a text message. And so now it's prompting for information about the text message. If it is a voicemail or, say, a phone call, there may be different default texts prompting your staff for what should be included in this note. Outside court cases that have been a part of this case of yours. Was it a state or tribal case? What type of case was this? And the court and information about the dates that the case was in that court and has it been transferred to tribal court. Documents, hearings, notes we've seen involve parties in the case and their role, which may be temporary, so we have dates for those. Assessments and drug tests we've seen, referrals we went through first, and finally, again, the status history of this case. That's a broad overview, but with hopefully enough details to give you an idea of what RiteTrack is and what it does and what it might do for your program. by documenting all of the background information about your individuals, giving you a better view of where they're at currently, to the daily case activity of the activity that you're taking in your cases, outside placements, tracking of your foster homes, as well as licensure, all of that being able to be done within RiteTrack, and then generate with a click of a button the reports that you require for council, for administration, for the boss, or for grant or other funding agencies. RiteTrack is able to do all of those things. And our goal with we manage data, you manage people, but we want your data to be able to inform you about situations in your population, about uh, successes that you've seen, about successful case plans and reunifications. What were the steps that led up to that? How can we replicate those? How can we take data to inform better outcomes for the families and children that we're serving? And that's the goal of a system like RiteTrack. It's to make you more efficient, allow you to provide more and better services, and affect better outcomes for those that you serve. So thank you again for joining me today. I'll put this last slide up once more. If you are interested in more information, feel free to reach out. Also, this webinar was recorded, and we will follow up with you in the coming days with a link to that recording, and you can respond to that email if you'd like more information about our Indian child welfare or any other modules. Thank you again for joining me, and have a wonderful afternoon.